Hi, I'm Dr. Lucietto, and I'm here to talk to you about hantavirus and Ebola. Now, the hantavirus is something that a lot of my patients have asked me about. The specific strain that is of concern right now because of the issues with individuals who've been infected on it from a cruise that was in the South American waters is a strain called the Andes strain, which can be transmitted through the air. Usually the hantavirus is a virus that is transmitted through exposure to feces from rodents, okay? The rodents are a vector, which means the rodents do not become ill with the virus. They don't demonstrate symptoms. So there's no way for you to know that those animals have this infection. They're usually not affected by it. And in some cases, it's actually a symbiotic infection for them, which helps them, but it hurts us. So being in contact with the feces of rodents, feces is also stool or poop from that animal. That's where we run into a problem. All right. Now, how these people on the cruise received the infection from the Andes virus, the details are unknown to me. This infection is a very serious one. The incubation period can be anywhere from 1 to 8 weeks, which is the scary part of the hantavirus. The other part is that a person can become ill very quickly and deteriorate very quickly, but the treatment options are very limited. It's usually limited to simply supportive care, which means we hydrate, we give oxygen, we give all the things that are necessary for life, and try to make a person as sturdy as possible so that they recover from the infection. But their own body systems have to fight the infection themselves. There's no antiviral, there's no antibiotic. Antibiotics are used only for bacteria. There are also some specific forms that treat fungal infections. We won't get into those details. The hantavirus is a concern. But the odds, again, are something that need to be examined. Now, what is the likelihood that you're going to be in contact with someone long enough to receive a viral load that will make you sick? That can be in question, and that can be a concern, particularly when you're out in crowds. But if you try to limit your exposure by washing your hands, don't breathe other people's air, do not share food, do not share drinking bottles, glasses, straws, do not share those things with people. Back in the day of great concern for tuberculosis, this was really pushed in the public health setting. And for whatever reason, if the general public does not have this information up in their face, they don't follow the advice. This is good advice. If you're going to go into a crowded area, wear a mask. Try not to stay there for a long time. If you're going to be in an enclosed area, wear a mask. Don't worry about being made fun of. I mean, it's not a ridiculous move. I've had patients who've actually had the audacity to tell me, oh, masks don't work. And I don't know any other way to explain to someone who has such limited understanding of filtration. All I can really tell them is next time you have surgery or a sterile procedure is being performed on you, make sure you tell the people who are coughing in the room that masks don't work. That's something where I can kind of get off on a tangent about beliefs and ideas. Ideas are supported by facts. Beliefs are an emotional process. Nobody ever dies from an idea, but they die from beliefs. So you have to be careful about beliefs. Now, there are a lot of beliefs that are supported by fact, but ideas are always supported by fact. And if they don't have the facts to support them, then they're a bad idea. So, getting back to the hantavirus. The incubation period is between 1 and 8 weeks. That broad period is very concerning because an individual can have no symptoms and then one day wake up and be sick. All right? So, and the symptoms are pretty nonspecific, fever, runny nose, upper respiratory symptoms, chills, Can you think of any illness that does not have that? And that's what I mean by non-specific. There are some symptoms of different infections that are pathognomonic, but we'll get into that in another video. Pathognomonic means that that specific symptom is so directed at the condition that you can be 90% assured that when a person has a pathognomonic symptom, that's the infection. That's the condition. That's the pathology. Now, the other concern is Ebola, all right? This seems to be a topic that comes up in the news periodically. Ebola is a virus that is included in the Hot 4. The Hot 4 viruses include Hantavirus. There's also Lassa fever. There's Ebola/Marburg. Marburg is a virus that's very similar to Ebola and sometimes is lumped under the same category. And then, God forbid, hopefully it will always be a memory rather than a fact in society, smallpox. Smallpox was a killer in the world. The World Health Organization, I believe, declared it cured or eradicated, but it wasn't really eradicated. It was declared no longer a public health threat. I believe it was somewhere around 1978. I'm not 100% sure, but it was around that time. Up until that time, individuals received the smallpox vaccine on a regular basis. And there were individuals that started receiving the smallpox vaccine back in the 1700s. It's actually a vaccine where an individual is exposed to an infinitesimal, tiny amount of the virus from an active pock that came from an individual who was ill with the smallpox. Those who were vaccinated in this crude, rudimentary way did become ill. They were put in isolation. They did become ill, but their illness was not super serious. Now, there were some people that died from this vaccine, but most survived. All right. Now, just because you have a couple of deaths doesn't mean that the process was a failure. Now, has that process been perfected? Yes. If a person becomes so ill that they actually need medical care, then they get it. That's something that we have a tendency to take for granted in the United States. It's not like we're living in Africa. I'm trying to think where else is another place in the world where you don't really get very good health care. I can think of some systems, but let's not get into that because we start getting into the whole belief idea, concept. Well, anyways, Ebola also causes fever. It can have bleeding from the eyes. That's usually a function of the sepsis, though. Nausea, hypoxemia, which is where you don't get enough oxygen, your saturation drops below a certain limit. You can vomit blood, have diarrhea. There are a lot of symptoms, but those are symptoms that are nonspecific. These are things that can happen with a lot of different pathogens. Now the Ebola can be dangerous, all right? There are a lot of people who have died in the world because of it. When there are potential cases, we try to get those individuals into isolation so that they don't transmit it. But again, the Ebola, unfortunately, it can take anywhere from 2 to 21 days after exposure for an individual to become ill. It all really depends on what is the status of the host or the individual who is infected and how much of the virus have they been exposed to. So those are concerns. But then, as I've mentioned before in another video, how many of you know that we are currently in the midst of an outbreak of measles? We have had pockets of measles for years, and they are a concern, especially for the person who is not vaccinated, who has no antibodies to protect themselves from the measles, and you can die from the measles. All right. There are unfortunately a number of people who have chosen not to vaccinate or not to vaccinate their children. It's quite unfortunate. There are many different reasons why they have chosen that, and I can respect a person's autonomy. That is something, if any medical students are listening, that we have to respect, or at least we are taught that, and we need to incorporate it and continue to use that respect in medicine. People are allowed to make their own decisions as long as they are of sound mind. Whether or not those decisions are well rooted in fact, wise, safe, are another story. People are allowed to make bad decisions. People make bad decisions every day. We have to respect those decisions. And in my practice, I try to. If I have an individual who comes in and says, "Oh, I don't want the vaccine. I've read all about it." I learned about it from, I believe his name was Andrew Wakefield. But there are a number of people out there that really have this belief that the measles vaccine is not safe. I mean, water is not safe. If you get it in your lungs, yes, that's not safe. But we won't get into that. Your health is way too important to be taken seriously. So I'm not here to scare you. I want to enlighten you so that you can make good decisions for yourself. The measles vaccine, in a nutshell, which anything in medicine is not in a nutshell, but in a nutshell, is made from two, depending on which vaccine you're dealing with, of the safest, although I say safest, viruses that cause the measles. There are approximately 40 different strains, all right? The Schwartz and the Edmondson strains have been shown to not be connected with panencephalitis. The biggest argument that people have against the measles vaccine, although there are a number of things, there's preservatives, but then again, we have single-dose vaccines, so we don't have preservatives in those little bottles. But there are other agents within the vaccine that are inert substances that an individual can be allergic to, but what are the odds? Again, we have to look at what are the odds, what's the risk, and what's the benefit. So the Edmondson and Schwartz strain have been shown not to cause this panencephalitis, all right? But there are 38 other viruses out there that can cause the measles and do expose you to the possibility of panencephalitis. That's fine. If you're vaccinated or if you are a survivor of the measles, for a good 10 years, perhaps more, but you can be pretty much ensured that as long as your immune system is intact, for 10 years, you will have intact immunity. Every time you're exposed to the measles, when you have vaccination status, or what would you say, antibody protection. When you have antibody protection, if you get sick, you will not get so sick that you will die. You might need medical attention because if you're exposed to a huge load of the virus, you're going to get sick. But if you're only exposed to a little bit of it, maybe you have a day or two where you're just like, I don't feel that great. I don't want to go out. I don't want to do anything. That's fine. Rest. That's your body telling you you need rest. All right? We all need rest, including me. And I probably don't get enough rest. But getting back to your health. The Edmondson and Schwartz strains do not cause panencephalitis. However, the other 38 strains, or the wild type infection, they could be Edmondson, they could be Schwartz. How are you going to know? You're not going to. You have 38 other viruses out there that can cause the measles. So the thing that people are afraid of is exactly what they run right into. Can they make that decision? Yes, they're allowed to make that decision. Is it an unwise decision? Well, that all depends on how you look at it. If you're afraid of getting a little poke, yeah, you could go without getting a little poke. And I will admit, the measles vaccine burns when it gets into you because it goes under the skin. It's a subcutaneous vaccine, and its pH is a little different from the human body, and that causes the sensation of burning for a couple minutes, maybe more like a couple seconds. Would you rather put up with that, or would you rather risk death and be sick, really, really sick for a couple weeks. Choice is yours. I'm thinking the flu vaccine is probably going to be one of our topics in the near future, but I have to get to work. I got patients in 45 minutes. So you guys have a great day. And remember, your health is way too important to be taken seriously.